Hello, everyone. Welcome to the KiltzHealth live stream with Dr. Nelson. I am your host, Dr. Nelson. Let me go live on Instagram, which unfortunately requires a separate step. And I'm just going to tell everybody that's listening right now, and maybe you can repeat it as people come in. We're having some technical difficulties, so you might hear a little bit of a feedback. Just ignore it and pay attention to the good information that we have Dr. Miskell here is going to bring us. Today, we're diving deep into the world of hormonal health and longevity. We're joined by Dr. Melissa Miskell. I am sorry, I apologize if I'm messing up your last name.
No, it's perfect.
Medical Director of Hormones by Design, who has spent over 30 years pioneering bioidentical hormone therapy. She's here to show us that the symptoms of menopause aren't just something to endure and how the right treatment can protect your heart, brain, and bones. Welcome, Dr. Is it okay if I call you Dr. Melissa?
Absolutely.
Yeah. Nelson is my first name. It's not my last name. It's just name is Nelson Vasquez. So, but I go by Dr. Nelson. So, if you have any questions, please put them in the chat. QQQ in front of it. I apologize if I miss any of them. Just repeat it. Be persistent. Please let me know where you're watching from, and let's go ahead and start. Doctor, can you introduce yourself? Tell us who you are. Give us actually a very brief uh, summary, because you just told me before coming on that you are carnivore. So uh, pretty much everybody that watches here is either carnivore or carnivore curious. So go ahead and introduce yourself and then tell us about the subject of today.
Okay, perfect. Well, thank you so much for having me on today. I appreciate that greatly. My name is Dr. Melissa Miskell. I am a board certified obstetrician gynecologist, and I have been in private practice for about 28 years. I am married, 3 grown children, and have just a delightful time with them. We actually just got back from Antarctica, so it was a amazing trip. So in private practice here, I have started doing hormone therapy probably about 22 years ago. We all took everyone off their hormones when the Women's Health Initiative trial came out. And
Me too.
yes, I mean, you had to. It was just what was done. And I actually had breast cancer patients that came to me saying, I would rather die. Something has to be done. I cannot live like this any longer. And so that began my foray into bioidentical hormones. And I did my own research at that time. You had to, and basically decided that actual bioidentical hormones are incredibly healthy. And so that began my journey into diagnosing and prescribing with bioidentical hormones. And I came up with my own design for an injectable hormone about 15 years ago. And so we have 10,000 patients and they all use injection therapy. And so it's a combination of estrogen and testosterone that is given monthly. And they are designed specifically for each woman. So it is not one size fits all. Some women have hot flashes, some women don't. Some women have vaginal dryness, other women have low libido. So it depends on what your lab values are and what your symptoms are. And the injection is designed specifically for each woman.
All right. So tell us a little bit. I mean, I know what you're talking about when you talk about the Women's Health Initiative in 2002, but many of the in the audience may not be aware. If you can tell us that landmark studies and the conclusions at the time and what it did to our practices.
Yes. So the Women's Health Initiative study was one of the largest trials that was put on to basically show that Premarin was good for postmenopausal women. The trial was stopped early, and data was published when it shouldn't have been. So, any women out there who are afraid of hormones, they may not know why, but it's because of that study that has propagated false information for 25 years. And so, what it showed was very, very bad science. And so now they've gone back and looked at all of that data multiple times and realized that the study was done so poorly. The average age of the women was 62, which is 12 years past the average age of menopause. And the two different arms of the study, one with just Premarin, one with Premarin and Provera, were poorly designed with women who were already ill. So that's what the Women's Health Initiative trial was. It scared everyone to death on hormones. And so those of us prescribing them just ripped everyone off of their hormones cold turkey, which caused all of these horrific symptoms to come on even stronger than they were previously when the women had started hormone replacement.
So, by the way, by the time that study came out in 2002, I had been a doctor already for 18 years. So, imagine you're driving down the highway at 65 miles an hour and you slam the brakes. That's what happened with the hormone replacement therapy. And then it
Yes.
has taken us 24 years. You know, many people realized it a few years ago, but it's been 24 years since then, and we're still having that negative
Yes.
effects from the study. When the data was revisited and reevaluated by many people like you, we found out that there were too many nuances and maybe the conclusions were wrong, right? So many women are told that hot flashes, brain fog, it's just part of getting older. Why should we stop accepting this as normal?
Yes. And so women have been told for, 2 decades now that they just have to live with their symptoms. Hot flashes, vaginal dryness, mood swings, brain fog, low libido, that's just a normal part of aging. And one of my main goals is to broadcast as loudly as possible that is entirely wrong. And so, what a typical physician who's not listening to their patients, they're going to prescribe an antidepressant, a medication for sleep, and a medication for anxiety. So, those three medications are the primary things that women are prescribed instead of just replacing their natural hormones, which will fix every one of those symptoms.
All righty. If you have any questions, please put them in the chat. And just a reminder, if you hear a little bit of feedback, it's we're having some technical difficulties, and that's part of it. All righty. So, yeah, antidepressants for hormonal issue, and unfortunately, depression is part of. It's not always the case, but very often depression happens to be a result of that hormonal dysregulation and menopause, right?
It definitely can be, but the depression is because of the symptoms, not because they're having an issue that a SSRI needs to take care of in their brain. That's not the reason they're depressed. They're depressed because they can't sleep at night because of their hot flashes. They're depressed because they walk into a room and can't remember why they walked in there because of their brain fog. And they're depressed because they don't want to have sex, or if they do, it's painful. Those are the reasons for their depression, not because they have an imbalance in their brain.
So it isn't a serotonin deficiency that's causing the problem.
Correct.
So you mentioned the average menopausal age is 50, and some women go sometimes very early. I've seen it as early in the late 30s, naturally, not surgically induced, but and then some other people are closer to the late 50s, rarely some 60s as well. When so we know sort of when it starts. When is it too late to have the benefit? Is there an age that is too late to start?
So the big answer to that is no. There is maybe not the most benefit if you start after the age of 62, 63. Your biggest benefit is going to be if you start in your 50s. But you still are going to get benefit for your bones. Estrogen is very beneficial for your bone health, strengthens your bones, and leads off osteoporosis. You're also going to be very beneficial for your brain. Estrogen, the other thing it does is it decreases inflammation, and that we don't really know exactly what causes dementia and Alzheimer's, but we do know that there's an inflammatory response, and estrogen will help decrease that inflammation. So it will help with your brain health.
Well, you just mentioned a very key word, inflammation, probably at the root of almost any chronic disease that we have, right? So can bioidentical hormones help with the menopause belly or the menopause weight gain or the stubborn weight that doesn't want to go away when you're trying to get rid of it?
Right. So, nothing is a magic pill. We used to say that, but maybe the GLP-1s are, but there's no absolute magic pill. But what estrogen does do is decrease your belly fat. And so that's when women go through menopause, their estrogen drops, and that's when they start to put on more weight around their hips and midsection. And so estrogen definitely can help with that. We're also a big proponent of testosterone. Most women don't actually know that they need testosterone, but there are 3 hormones that women make: estrogen, progesterone, and testosterone. And testosterone is one of the leading hormones for muscle mass. And so once your testosterone is replaced, then your muscle mass also will increase.
Yes, I often remind people that to make estrogen, you need testosterone because that's
They're
where it
almost the
comes
same
from.
molecule.
And then in men, to make testosterone, you actually need progesterone as well. So they're all interrelated, and they do have all a skeleton, a base of cholesterol, by the way.
Correct.
Uh, all right.
That's why if you are on a cholesterol lowering drug, then you're at risk for all of your hormones: estrogen, progesterone, testosterone, vitamin D. All of those hormones are made from cholesterol.
All right. So we talk about bioidentical hormones. We talked about what was used in the study, which was mare's peas estrogen, right? Uh, what is the difference between synthetic or bioidentical hormones or horse derived hormones?
Right. So you get into a little bit of semantics when you start talking about synthetic, natural, bioidentical. And so, yes, Premarin, the main estrogen replacement that has been around since the 50s. What is made from pregnant mare urine. That's hence the name Premarin. And so it is a whole collection of equine estrogens. There's, I think, 30 plus different equine estrogens that are in Premarin. So none of us have receptors for horse estrogen. And so they will alleviate your symptoms of hot flashes, but they will not protect you for your bones, your heart, and your brain, because horse estrogen doesn't fit into human receptors. So that's the difference there. With progesterone, the number one progesterone is a progestin, Provera. So it is not even a progesterone. And it was invented to protect women's uteruses from developing cancer when they were exposed to just estrogen, what we call unopposed estrogen. So that was Provera's primary place in life, was to protect your uterus. So that's why progesterone sometimes gets a really bad rap, and doctors will not prescribe progesterone if a woman has had a hysterectomy. But progesterone has so many receptors in your body, and it is the feel-good hormone. It's the one that makes you sleep. It's the one that affects your mood. So progesterone is very important. And so bioidentical hormones are synthesized in a laboratory. But just as we can make insulin, we can make thyroid, we can also make estrogen, progesterone, and testosterone. But they are the exact chemical structure as what our bodies make. So they are bioidentical, they fit into our receptor sites, and they protect our heart, our bones, and our brain.
Okay. Let's take a question from the audience here. And Sheila MQ is asking, I'm 63, postmenopausal, taking bio-TE for 4 years, carnivore off and on since March 2023, strict carnivore since March 15, 26. We're not on March 15, 26 yet, but may have meant 25th. Have been bleeding like normal period with cramps. Tests only show atrophy. And she did have, let me see if the other question is related to this, because she has two things. If it's a continuation. Same thing happened when I started carnivore. See above, have others had some experience? Okay. So
my question would be, are you taking progesterone? Because progesterone is what stabilizes the endometrial or the uterine lining and keeps it from sloughing off. And so at 63, you should not be having a period. There is no reason. That's one of the few blessings of menopause, is to no longer have a period. And so bio-T is typically just testosterone. So my question would be, are you also taking estrogen and progesterone?
all right. Maybe she can comment in there. And let me see if there are any other question. Yeah, she says yes, taking progesterone.
Okay, then you need to
Doesn't
increase your dose of progesterone. Do you have your labs checked? A lot of times with bio-T, they don't check your labs. But if you get your labs checked, you should increase your progesterone.
All righty. Many women feel frustrated when patches, pills, creams don't work. So why do these delivery methods often fails? And my next question was going to be, it's kind of a follow-up to this one. What did you develop to overcome that problem?
Right. So there are patches, pellets, pills, ready dissolved tablets. There's lots of different, you're welcome. ways to get bioidentical hormones into your system. Typically, taking them orally is the least known or desired way, because then they go through your liver, and that's just not the best way. They get broken down very, very rapidly. Creams, patches, those fall into whether you can absorb those. And it takes it, everyone absorption is different. And so sometimes it takes a lot for the cream to be absorbed readily. And then it's just such a varying amount that it's hard to get it exact. Lots of people use pellets. I have done pellets myself, inserted them, and they work really well for some people. The problem with pellets is that once they're in there, they're in there. They can't come out. And so that's something you're stuck with for 3 months. So our delivery system, it's very, very important to have your labs checked. I can't stress that enough. A lot of times physicians will just be like, oh, you're postmenopausal, you don't have any hormones, so we'll just start you on this. And then they never check your labs. So checking your labs for your lab values is very important. With our delivery system, it's once a month. We check your labs every month until we get you on a steady dose that you feel good on. And I mean, that's our most important thing, is how you feel. That's what we say, feel better from day one. So that your labs and your symptoms should come together. And your labs aren't too high, your symptoms are great, you don't have any of the hormonal menopausal symptoms anymore. And then you're on a steady dose once a month, little tiny tuberculin injection. And then we'll just recheck your labs every 4 months, just to make sure that we're where we want to be.
All right. So test, don't guess. And basically you're looking for that point where the symptoms have gone away, among other things, right?
Right.
And all right. We have another question from the audience. All right. Ruth, 9396. What are the levels of progesterone, estrogen, testosterone for postmenopausal women who have had a hysterectomy?
So there's kind of two parts to that. A hysterectomy, where you take the uterus and the ovaries, then women, that's a surgical menopause. Women go into menopause when they're leaving the OR. If you have just had your uterus removed with a hysterectomy, then your ovaries will continue to produce hormone until you go through menopause. For women who are already in menopause, it doesn't really matter that you've had a hysterectomy. Your ovaries aren't going to work anymore. And so all your levels will be what we call unreadable. So estrogen would be less than 17, progesterone basically 0, and testosterone also 0.
All righty. Now, before I bring up this next question, I have to remind the audience, we are physicians. We are not your physician or provider, and you're not our patient. So any comments we make or recommendations are for educational and entertainment purposes. All right. So Nina Chiolo, IRS, 8085. I went off my HRT due to probably benign growth in underarm lymph node. I need to have it retested in 3 months. I will be 71. Should I consider starting HRT again if benign?
Absolutely. 100%. I'm sure that you have had symptoms that have come back that are unwelcome. But regardless of that, your hormones, since you have been on them for for probably a long time are very beneficial for your bones and your heart and your brain.
And there is really, even when reevaluating all this data, and especially using bioidentical hormones, uh, there is really no evidence that this is going to increase your risk of cancer or other things,
No,
heart
you're
attacks,
absolutely
which
right.
were.
There is absolutely no research that shows bioidentical hormones increase any cancers. They're actually very protective. So there is really no health risk.
Do you look for any other specific lab markers beyond the, testing the estrogen, progesterone, testosterone levels?
We do. We're a full, basically, hormone clinic. We do thyroid, we do vitamin D, and we do GLP-1s. We do weight loss drugs for our patients that fall into a certain realm for that. And so, yes, we do quite a bit of testing.
Okay. Now, we've mentioned testosterone a few times. It is important for women's health, but what does it do in women's health?
So testosterone is really important for your bones. Hence, one of the reasons men don't get osteoporosis as frequently as women. Women their bones start to decline once they go through menopause and stop making their hormones. So very beneficial for your bones. Testosterone also works really significantly in your brain for brain fog. That whole, like, you can't remember names like you used to be able to. I mean, I have teachers that are like, I used to remember every child's name, and now I can only remember, the ones that are in front of me. I can't remember them from other classes, that kind of thing. That has a lot to do with testosterone. Also, your energy level. Testosterone is what has a big influence on that. And then finally, your libido. So those are the main things: your bones, your brain fog, your fatigue, and your sex drive are all beneficial with testosterone.
All right. Can the bioidentical hormones be used in women with a family history of breast cancer?
So, it's very important to make sure you keep up with your imaging, whether it's thermography, mammography, breast ultrasound. That's just in general important for all women, because our risk of developing breast cancer increases as we age. And so, as long as you keep up with your imaging and you don't have a BRCA gene, like that kind of family history risk, then bioidentical hormones are fine. If your aunt had breast cancer, but she does not have a BRCA gene, then that does not increase your risk of breast cancer. So bioidentical hormones are actually protective against breast cancer. That's what the leading research has shown now.
All right. We have a couple of more questions. Sheila asks, what is a good level / score for testosterone in females,
So
I'm assuming?
yeah, so testosterone, again, it's specific for each woman what her levels should be, but somewhere, around the 100 range is what most women feel good at. But then, there's some on either end of that for sure. But that's just an average number. It'd be 100.
All right. Bumblebee T UK, welcome from UK. 54-year-old with ME/CAS, and neurodivergent, struggling with sleep, moods, and sweats and depression. Is HRT very safe? Family history of cancer and cardiovascular disease.
So, yes, again, bioidentical hormones are going to help with all of your symptoms and be cardioprotective. So, it's not going to increase. There's nothing that has shown that bioidentical hormones increase any kind of cancer, but they are very protective for the cardiovascular disease. Progesterone is going to help with your sleep and your moods. Estrogen is going to help with your sweats. And all three hormones will help with the depression. But once you get rid of those symptoms, your depression will improve.
All right. What are the common misconceptions doctors have about the safety of bioidentical injections?
Well, most physicians are scared to death of hormones. They do not learn about hormones in medical school or residency. Even me, as a specific female physician, for women, I did not learn anything about bioidentical hormones or hormones in general. Really, just Premarin and Provera, and never check a lab, any of that. So most physicians are just scared to death of hormones. They don't want to treat women with those symptoms. They would rather send them to someone like me or give them the three medications that I spoke of previously, just to make the women be quiet. So, yeah, that is the common misconception. It also, the Women's Health Initiative trial really, really tainted everyone. And so physicians are just scared to death of hormones.
All right. Does a high fat carnivore lifestyle change the way the body processes or requires hormones?
I mean, certainly if you're eating beef or really any kind of meat, the meat has hormones in it, even whether, even if you're eating all natural grass fed, just meat in general has hormones. And so it also has the building blocks for you to make hormones. And so, yeah, it definitely is probably easier to alleviate symptoms if you're a carnivore.
Highly recommended. So, just explaining a little bit more on that for the people listening who, I buy meat without hormones, but uh, cattle, cows, beef are an animal, a mammal, and they have their own hormonal system. So, when we eat the meat, even if they haven't been given
Mm-hmm.
hormones, they have their own hormones, and they will be in their system, right? So that's what you're talking about. All right.
Correct.
Heart disease is the number one killer in women after menopause, and it's essentially the number one killer in men as well.
Yes.
Strokes, heart attacks, and hospitals, probably the top three causes of mortality. But heart attack, whether it's or cardiovascular disease, whether it's a heart attack, a stroke, and many other cardiovascular problems, uh, in both men and women. But after menopause, women's rates increase. So, how does the estrogen act as a shield for the cardiovascular system?
Right. And you're 100% right. No matter what anybody says about any kind of cancer or anything like that, the number one killer of women is heart disease, period. And so that's what the biggest fear should be, is how do we protect our hearts? How do we make our hearts last longer? And so heart disease typically is due to plaque. And what estrogen does is if you already have plaque, it stabilizes that plaque so that it can't break off. That's what causes a heart attack, is when plaque breaks off. Also inflammation. Again, estrogen reduces inflammation, so that those blood vessels that are carrying all of that blood have a better chance of getting that blood all the way through to the heart. The other thing estrogen does is that it is a proponent of good cholesterol. So it will increase your HDL and decrease your LDL with your cholesterol panels. So it's not rocket science. Women do not have heart attacks until they go through menopause, and then that's the majority of things women die from. So obviously your hormones have a lot to do with that.
All right. Let me take a quick look here. Don't see any questions. So, osteoporosis. Tell us about women, HRT, osteoporosis.
And osteoporosis?
Yes. Why is
Yeah.
hormone therapy more effective than standard bone density medications? Which
Yeah.
I've been always very disappointed in the osteoporosis medications that they came around all rah. First one to come into the market was Fosamax, and then a bunch of others. But have they lived up to their hype?
No, they actually cause bone fractures. It's been very disturbing. All of the Evista and Fortaz, all of those medications are actually more harmful. And so there are two types of bone that we have. One is building bone up, an osteoclast. Osteoblast breaks bone down because your bone is constantly rebuilding. And so when women go through menopause, the osteoblast overcompass the osteoclast. And so you have more bone being broken down and not enough bone being remade. And so estrogen reverses that. It allows the osteoclast to continue to mineralize your bone and make more stronger bone, and the osteoblasts get put in their place. So that's how estrogen works for osteoporosis.
All right. Another aspect of this whole issue, we hear about type 3 diabetes, Alzheimer's, right? How does estrogen therapy impact long-term brain health and dementia prevention?
So, that is a very hot topic right now. There's lots and lots of research going on with dementia and Alzheimer's. We actually have no real strong clue as to what causes either one of those diseases, which, they do think that they are separate, but no good reason for any of them. But again, the inflammation aspect of Alzheimer's and dementia is there. And we do know that estrogen decreases inflammation. So the good thing about estrogen therapy is that it is going to slow or delay any sort of dementia or Alzheimer's just because of the anti-inflammatory response.
All right. So this is a very interesting question from a female in the audience. Because is it okay not to take anything? She put not to take nothing, but
Right. And so certainly, everyone has their own choice as to what to do, but just, again, heart disease is the number one killer of women, and women have heart attacks after they go through menopause. Osteoporosis becomes very prominent after menopause. Brain health also very prominent. And so it's certainly okay, but it's not what we call healthy aging. healthy aging is that we go into menopause and into our 70s, 80s, and we feel great, and we're still very healthy. Our heart's strong. So that's kind of what our whole goal is that you have a great life, because we live 50% longer now. I mean, average age used to be to die in your 40s, 50s. Now it's not uncommon. My mom's 92. So not uncommon to reach the 80s and 90s now.
All right. I want to take a moment to remind everybody we have a few events coming up in March and April. And so I'm going to be in Melbourne on Friday. Dr. Kiltz is not going to be able to make it. We're co-sponsoring the cholesterol coach showing with Dr. Varia and Susie Boshoff. And that's April 6th. If you go to KiltzMeetup.com, you can get tickets there. And April 11th and 12th, we are having a couple of meetups in New York. One is in Long Island. The link is in the page there. The other one is a Queens, New York meetup with Dr. Nelson and Lois Lotito. You're going to spend the day at the Mets game and then go to a Korean barbecue dinner. And you'll spend the whole day with us. And it's not here, but you also will get a shirt, a steak a day shirt. It's included in that price, by the way. And we have to update that. And then at the end of April, beginning of, May, uh, not yet, the cholesterol code, we're doing in Altamont, April 22nd. And Altamont is Orlando, okay? So if you're near Orlando, you know anyone near Orlando, send them the link so they can watch the cholesterol code with us. And then May 1st, 2nd, and 3rd, we're going to be in Meatstock. Dr. Kiltz will definitely be there as well. All right. So for women on a carnivore diet, and many of the women here, like I said, they are on the audience. We have mostly carnivores or carnivore curious, or some carnivores that have some occasionally other stuff. We see great improvements in inflammation. How do hormones further assist in lowering systemic inflammation?
So hormones have been shown time and time again that is one of the main things that they are prevalent at, is decreasing inflammation, whether it is around the liver or the heart or the blood vessels or the brain. It is ongoing research that is just shocking at how well estrogen can eliminate inflammation.
Okay. Sleep is a big problem for very often some postmenopausal women. Is it estrogen? Is it progesterone? Is it the imbalance?
Right. So, there are two main reasons typically for sleep. One is hot flashes, because you just wake up drenched, have to change your clothes, change your sheets. And multiple times through the night. And then the other one is just women who just can't sleep. They can't fall asleep. They can't stay asleep. And so estrogen is what's going to help with the hot flashes. I mean, help like in them. And progesterone is the one that actually will allow you to go to sleep and stay asleep. So it's definitely a combination of those two hormones that will change your life as far as sleep goes.
All right. So I think we've touched on this a little bit in some of what you said, but I want to redirect the question. If a woman has already had a hysterectomy for whatever reason, does she still need progesterone, or is it estrogen enough?
100%, she still needs progesterone. Do not let anyone talk you out of that or convince you that you don't. Progesterone in the old days was given just to protect your uterus from cancer. That's the only reason. Now we know all the other benefits that progesterone supplies to women as we go through menopause and as we age. Obviously, the sleep, but it is a mood stabilizer. It is what is going to keep you from having those big mood swings that affect your daily living, affect your children, affect your marriage, affect your work. Progesterone is what helps with that. Not to mention all the other breast cancer benefits that progesterone has. It's very protective for your breast tissue.
What do you think is the number one silent symptom of estrogen being low?
Heart disease. Absolutely. It is the number one symptom, and that you're not going to feel. I mean, nobody really feels that they have plaque in their blood vessels. Nobody really feels that their cholesterol is high. No one really feels that their blood vessels have inflammation. So it's, I think they used to call high blood pressure the silent killer because it caused so many problems, but no symptoms. And that's exactly what your lack of estrogen is as far as your heart disease goes.
All right. Now, what is the one thing you wish every woman in their 40s knew about her upcoming second act in life?
That she doesn't have to live with it. Do not let anyone tell you, oh, this is normal. You have to live with these symptoms that you're having or going to have. The hot flashes when you're giving a presentation at work and you're dripping sweat. The mood swings, you can't remember anything. You don't want to have sex anymore. All of those things are not normal. That is not normal. So that's what I would tell every woman who has not yet gone through menopause. Don't let anybody tell you that those symptoms are normal.
Okay. Should women be afraid of testosterone?
No, not at all. It's a normal hormone that we all have. Testosterone is great. It does many things to help your health in your body, from helping with your sex drive to your fatigue to your brain fog. The other little known thing about testosterone is it actually helps with migraines. So there are clinics that just give testosterone for migraines. So if that's something that when you got into menopause, you started having more headaches and migraines, that's what you should look into as well.
Okay. You've developed this system, this injection. Why choose an injection over, let's say, a patch?
Well, the main reason is because it is specific for you. It is exact. You're not getting the same hormone injection that Susie's getting or that Mary's getting or that Elizabeth is getting. You're getting the hormone injection that is directly selected for you depending on your symptoms and your lab values. So you're not getting the same patch that everybody else gets or the same testosterone pellet that everybody else gets. You're getting something that is specific for you.
Okay. Now, this next question, I've asked a few experts and get different answers. So, uh, can you start hormone therapy if you've been in menopause for 10 years or longer?
So there's some research that shows that it might not be as beneficial for your heart if you start hormone therapy later, up to 12 to 15 years past menopause. But that still doesn't mean that it's not beneficial for your brain and your bones. So yes, you can start hormone therapy at any time.
All right. Before you answer about hysterectomy and progesterone, if a woman has their uterus, are we now talking about if you're going to do estrogen, is progesterone mandatory?
Absolutely. You can, if you have a uterus, you cannot take what we call unopposed estrogen. It is a very high risk for developing uterine cancer. And so if you have a uterus and you start hormone therapy, you must take progesterone.
Do you have one word to describe the feeling of having optimized hormones?
Happy.
Okay. That's good. So, I mean, you've mentioned different things, benefits of estrogen, and probably answered this question already, but I want to ask it anyways. What is the most important protective benefit of estrogen?
It has to be heart disease, since that is the number one killer of women. And we know specifically that heart disease starts when menopause starts. So estrogen is just clearly very protective for heart disease.
All right. Looking at the time, let me check if there's any questions here. Um, so we have one question and a couple of questions here. Let me bring this up. Uh, Faith Focused Food Freedom. Do you have an office where you see patients? Where
Yes.
I didn't ask you, what state are you in?
I live in Texas,
Okay.
but we have providers that are all over. And so what we do, we have a website called Feel Better from Day One, because that's what we do. We have you get your labs drawn before you first see a provider. You can see a virtual provider, and they will go over your labs and your symptoms with you, and then they will design an estrogen testosterone injection that can be mailed directly to you. And so we really can see anyone pretty much throughout the United States. So if you just go to our website, Feel Better from Day One, then we'll be happy to get you on board.
All right. So this question is from Brisket Boomers. By the way, you do so. Do you, just going back to the previous question? This person that was asking, I know she's in Florida. You can see patients from any state.
Almost.
Okay.
California is a little tough. I have providers in Florida. So yes.
Okay. All right. Brisket Boomers is asking, I'm 73, a type 1 diabetic, hence very low carb for 30 years. Carnivore for the last 7 years. At 52, I never had any symptoms of menopause except my period stopped, right? What does that mean? And I'm
You're one
assuming
of
she
the
means that she hasn't had symptoms of menopause.
Yeah, you're one of the very few lucky ones. Um, there are women who do not have any symptoms. It is very rare. The majority of women have some sort of symptoms with menopause. But just because you don't have symptoms does not mean that the protectiveness of your hormones is still there. They're gone. Your hormones are definitely non existent. And so you still have the same risk of heart disease, brain, and osteoporosis.
All righty. By the way, she walks 10 miles a day. Uh,
That's probably why she doesn't have symptoms too.
all right. Um, all right. We have a few minutes before the top of the hour. Let's talk about a subject that is uncomfortable for some to discuss with a provider, to even discuss with anyone else. Libido.
Hmm. You're
Is it
absolutely
all?
right. It
Is it all
is
in their
typically,
heads, or
we I don't know, maybe because I'm a female and all my patients are females, we hear it and talk about it all the time. But certainly, if you're uncomfortable talking to your provider, if they're a male, or if they're just like typically saying sorry, you just have to live with it. You need another provider. You need to find someone who will listen to you and will help you. And there's other things to do besides, necessarily hormones. But if it's vaginal dryness is the reason that you don't want to have sex, then there are other things that can help with that are just vaginal. um, and so I would greatly encourage you to change your provider if you're uncomfortable speaking to them about libido, because I mean it's a big part of life, especially in a marriage. So yes, that's I would definitely encourage you to find someone you can speak with.
yeah, definitely it's not affecting only one person in that interaction, right? It's affecting someone else.
Right.
Many carnivores drink coffee. Does caffeine interfere with bioidentical hormone absorption?
No, I've never seen anything that showed that there was any kind of interference or cross-referencing with caffeine and bioidentical hormones. I mean, because you have to realize you have bioidentical hormones from the time you go through puberty. And so there's never been any correlation with caffeine.
All right. If someone wants to go to your website, what did you say?
So
The
feel better from day one.
feel better from day
Um,
one. Okay.
right. Or you can Google hormones by design.
All right. Hormones by design and feel better from day one. Do you have any last words for our audience?
Well, I would just encourage you to be very proactive and very vocal about your own health, because it's your health. And so if you're not happy with the care that you're given, then I would encourage you to find someone that you are comfortable and happy with.
Thank you very much, Dr. Melissa Miskell. Thank you for doing this with us. You're welcome to come back anytime. Uh,
Oh,
for
thank
those
you.
of of you that are members of the Kiltz Mighty Tribe, will be in the community at 5:30 in our Zoom call for Tuesdays. Okay. You have a great day. Thank you again for being here and eat meat.
Thank you very much for having me. It was delightful.
All right.